if you look at healthcare in Africa, and starting by the bigger picture, the demography, we're about in the continent 11% of the world's population, but we're 24% of the global disease burden. And we're only 1% of the global healthcare spend and 3% of the global workforce. So you can see the challenge that we have to face. And if you drill further down, you have to solve for still burden in the healthcare space that go from communicable diseases. Malaria, HIV still is responsible for the death of most Africans today.
Right.
You have the burden of maternal and infant mortality. We've got 60 death out of each 1,000 birth lives in Africa. That's 5 times what it is in Europe or some other parts of the OECD world. So we have to solve for these burden. And unless you have a strong, utilized, structured primary care level, which caters for the bottom of the pyramid, I would say,
right,
both in terms of the population we're serving, which beyond 60% are in rural areas or non-urban areas, and the rest of the population. So the private sector, like GE, decided to really change their business model in terms of not just supplying technology and waiting for things to happen,
right,
but being more a player within the ecosystem.
Tell me, what exactly is General Electric doing in this space? Some of the innovations that we're looking at currently in healthcare, what are some of those?
So 3 things.
Right.
1, we have created 5 years ago a division called Primary and Referral Care.
Right.
So it's a dedicated team of GE employees across the continent that are focused only at working at delivery models at primary care level. We have combined that with partnership with either global or regional players. AMREF, for instance, which is the main organizer of this conference,
right,
is what we call an implementation partner to deliver long-term, quality, and affordable care at primary care level. So we partner with them as a technology and solution provider. So it is a model that combines adapted technologies. And when I say adapted technologies, when you're dealing with maternal and newborn health, or you're dealing with some of the infectious diseases, is to work on ultrasound technologies to be able to detect risks at pregnancies very early and prevent maternal and newborn death.
right.
It is also baby warmers at primary level. So really technologies that have been designed
Right.
ultimately to be used in limited resource environment. But it's not enough. You need to train also the users of this technology.
Right.
And you're not going to train radiologists or doctors
Right.
at primary level. You're going to train midwives, nurses, and health community workers. So we've done that with partners. And this is a model that we didn't have 5 years ago in GE, because our traditional delivery model was really provide
the technology
and service
right.
to the maximum, service and maintenance,
right.
but nothing else between education, training, and long-term kind of solution.
Farid, if you look at some of the set goals, of course, putting in alignment with the United Nations,
Yes.
Health for All, 2030. What are some of, discuss to me some of the innovations that you think can be put in place to improve access to healthcare? I mean, currently, if you're looking at a case of financement being one of the biggest hindrances to UHC, what do you think, or maybe from where you stand, what are some of the innovations that need to be put in place to improve access to healthcare?
Thanks, Michael. That's a critical question, because we talk about universal health coverage at the horizon 2030.
Right.
But really, what does it mean to the attainment of this goal?
Right.
In terms of solutions that could be options, and we're starting shaping out from some of the convening of a forum like this one, is the collaboration between the private sector. Companies like GE that can really bring their knowledge in technology, in education, in service and maintenance, longer term, their capacity to execute locally. Don't forget, GE has more than 2,500 people, GE employees throughout Africa.
Right.
So we're a local company. We think of ourselves as a global but local company, and we can execute in the long term those kind of challenges. But it's not enough. And you mentioned financing, which is critical. And today, we need to shift from, particularly at primary level, most of the programs have been funded by donors, either CSR or really donor funding.
Right.
Is it really sustainable over time? And we're seeing already the shift from donor funding to more economically self-sustainable models with the private sector providers delivering services to the government, be it local government or national governments, institutions. So getting the donors and the financiers, which oftentimes is the public sector through their budget, working closely with the private sector and shifting that funding into the most efficient delivery models that bring quality, affordability, access, and cost.
Right.
And I think this is quite a very simplistic way of putting things, but if we can achieve that, I think we're going to be able to direct the funding into solutions that deliver outcome and service to the patient, not for 1 year, not for 2 years, but for 50 years.